Let us talk about esophageal diverticulas. Diverticula is any abnormal pouch. Esophageal diverticulas develop by two different mechanisms. Number one, the Pulsion type. Number two, the traction type. In the Pulsion type, there is distal obstruction for a prolonged period of time that leads to increased intraluminal pressure that eventually causes an outpocketing or outpouching. Talking about the traction type, it is because of a 360-degree esophageal granulomatous inflammation that eventually leads to fibrosis, which causes weakening in the wall that leads to outpocketing in the form of a diverticula. Now both these type occurs at specific locations. The Pulsion type occurs at the two ends, the upper end and the lower end, but the traction type only occurs in the middle portion, named as mid-esophageal diverticula, and it does not require any treatment. On the other end, talking about the two types of the Pulsion esophageal diverticulas, the one that is present in the upper end is known as Zenker's diverticulum, and the one that is present at the lower end is known as epiphrenic diverticulum. Let me compare and contrast different features of these two diverticulas. Talking about Zenker's diverticulum, it is a false diverticulum. What we mean by false diverticulum that it does not encompass all the layers of the gastrointestinal tract. It only has mucosa in the diverticulum. Number 2 point is that Killian's dehiscence is the point where Zenker's diverticulum develops, and what this point is a weak link between thyropharyngeus and cricopharyngeus, which forms the inferior part of the pharynx. Regarding epiphrenic diverticulum, it develops at distal 10 cm of thoracic esophagus either because of esophageal motility disorders or because of mechanical obstruction. Talking about signs and symptoms of Zenker's diverticulum, it causes dysphagia, regurgitation of small food particles. Specifically, the patient will give a history that he or she found small pieces of a meal they took a week ago. And because of collection of food in a pouch, there will be bad breath known as halitosis, and because there is an outpocketing in Zenker's diverticulum, the patient will have a gurgling noise during the process of swallowing, which is a characteristic feature. On the other end, epiphrenic diverticulum will also present with dysphagia and regurgitation. So how we will differentiate? There is only one investigation, that is barium swallow. Now barium swallow will help us differentiate between Zenker's diverticulum and epiphrenic diverticulum. In Zenker's diverticulum, surgical excision is done, and epiphrenic diverticulum is only excised if it is more than 3 cm. As you can see in the right corner, there is middle constrictor muscle, there is inferior constrictor muscle. In the inferior constrictor muscle, the lower part, there is a weakening in the wall which leads to outpocketing known as Zenker's diverticulum. As you can see in the image below that, there are two parts, and it actually shows the treatment. First of all, we will cut the Zenker's diverticulum and we will close that defect. On the left hand side in the figure B, the esophagus in the middle has a diverticulum known as esophageal diverticulum that will also present with trapped bolus. This esophageal diverticulum can be seen in a barium swallow in the form of an outpocketing, very clear, and if an endoscopy is done, which shows there are two mouths to one canal, which can only be present in case that there is one outpocketing and one normal lumen of esophagus. So I hope now you have a much better concept about esophageal diverticulas, how they develop, where they develop, how they can be identified, and how they can be treated.